Sometimes you're working with other professionals or other providers, and the providers, I don't know what is happening, because me personally will never give out another provider's telephone number to any patient or them family. Me always go ahead and give the practice number, because me know that me don't want any patient to be calling me at 10 o'clock, 7 o'clock, 3 o'clock, whatever time in the morning, noon, or night, regarding any compound, no tour, no prescription, no chest pain, no shortness of breath, nothing at all. I don't want them to be calling me. I want them to be calling the office through the office line, the recorded line if there is one. I want them to talk to somebody else who will take documentation and then relay that information over to me. Why I say that is because I've been working with this practice, and for some strange reason, I gave my number to one person. And it was a good thing I gave my Google number. Yes, my Google number. I gave my Google number to one person, and it was in relation to a patient. We had a conversation, and it turned out that she updated me on what was happening fine. Long and short of it is that she called the office. She never get through to the office. She left a message. She left a message on my phone. At the time I was busy, never get in contact with her, only to find out that there are 3 other persons that left a message on my phone regarding the same patient, a non-emergent situation. And they keep on bothering my phone. And then she keep on texting me about the same situation, that if I've done this. And what is it that she's wanting? She wants me to put patient on palliative care. Patient doesn't meet palliative care requirement. And I have a ton of people calling me regarding this, and I don't appreciate it. So if you're a nurse practitioner out there, if you're a provider out there, don't give out other person's personal number to anybody. Don't give out the number to anybody out there, because there are certain things that can wait. It's not an emergency. Referring a patient to palliative care is not an emergency. It's not an emergency. I don't want anybody calling me at daytime, noontime, morning time, no time at all. Give the information to the office, and we will make an appointment, and I will see you at the specific time for the evaluation. There are criteria for different referral. If the patient meets the criteria, then, or if you as a nurse practitioner see the patient, go ahead and do the referral. And is that she decided that she was going to do the referral, which was good, because the patient doesn't have the diagnosis. Her labs are all perfect. She's on 2 medication, vitamin D and levothyroxine. So be careful with the, how you go about with issuing out other providers' telephone numbers out there, because they don't know what number you have access to, what personal information you have access to that you're giving to patient out there. Because I had given her that telephone number. What if it was my personal number? She didn't know. Those persons could be calling me right around the clock, right around the clock. I tell you the amount of missed call and the messages that they've left on my phone. It's a good thing that phone is like in a little corner. It's a mobile phone, but it's like a landline. I don't really pick it up like that. It goes straight to voicemail. So I will see the messages, whenever they leave them. It's a good thing it's like that. You keep on hearing all of these calls coming in unnecessarily. Because when somebody's going to call you at 4 o'clock in the morning asking if the prescription is ready, like, I'm not the pharmacy. I'm not the pharmacy. Call the pharmacy to find out if the prescription is ready. So things like those. So just be careful out there when you get a number for a provider. It's not for the entire world. Give the patients a practice number. If you cannot get through to me as a provider to provider, have the patient call the practice and try to get in contact. Whenever you get in contact with me, then you try to figure out, okay, what is it that you needed? And then what is it that you can help the patient with? Then you try to communicate that to me or to the provider. But do not give out, another provider's number to any patient and the family members. When me upon my vacation, I don't need no phone call or call me about no prescription or no compound tour or arthritis. Me stop seeing a patient in a practice how long? Couple months well. I don't want to hear about no patient I saw a couple months ago. I stopped seeing that patient a couple months ago, and another provider is seeing that patient. So let's not be in the habit of issuing out our telephone numbers to individuals just because we have access. We have the privilege of, you know, getting it. And because you have the privilege of getting it doesn't mean that you have the privilege of issuing it out to other persons. Let me go and see my patient because my patient look out the door. Yeah, she see the car, so she say, yeah, come on, ma'am. All right, then later.